Classification. So here type 1 and type 2 mostly can be managed conservatively. Type 3 is still controversial, but type 4 and type 3B, type 5 and type 6 definitely needs surgery. Even when it's associated with fractures, distal fractures, lateral and lateral fractures, we may use this technique. So basically here two buttons, the one is superior, one is inferior, placed, and the distance between the coracoid and the clavicle is approximated. So technique is three portals: posterior portal, anterior and anterolateral portal. This is visualization to the anterolateral portal and preparing to the anterior portal. So we are under the base of coracoid. So there is a specific zig. Okay, once your coracoid preparation is done, so there is a specific zig which passes through the clavicle onto the under surface of coracoid. Then you pass a shuttling suture, get the button placed. Okay, we are shuttling the button now. So this is the under surface of coracoid. So the button is placed. So the button can flip either way. So you need to place the button properly with using a grasper. So get the button placed. So there is some kind of suture entanglement. You need to prevent that. So once the button is placed, you can reduce the AC joint and fix it on the clavicular side. So finally, the button is placed. So open approach, you can go with a brass track incision, so vertical incision, anterior to posterior. Identify the landmarks. You can use the same zig, or you can directly visualize past the shuttling switches, past the dog button. Always keep the image intensifier ready to check for your reductions. Reduce with an elevator or a periosteum and fix the button on both sides. As you can see, the is well reduced. So here, if there is associated fracture type 2C and above, then there is injury to the CC ligaments. So you can just still go ahead and do the dog button over a plate or without a plate. So this is a fracture fixation without a plate. You have a good reduction. So it's comminuted fracture, locking plate with augmented. Now this is the gold standard for these distal and clavicle fractures. There have been some studies which suggest just the button is enough, but we prefer plate with CC augmentation. So a large series of patients, 18 to 20 patients with long-term follow-ups, all of them have done X-ray with this technique. So immobilize for arm sling for 4 to 6 weeks. Pendular exercise alone. So most rehab protocol for all the shoulder surgeries, including I think labrum is same. So we immobilize for 6 weeks. Pendulars from day 1. Passive assisted from week 2. Active movements are allowed only after week 6. And strengthening and therapy starts after 12 weeks onwards.